Well, hello everyone. I am here today with Dr. Mehran Arabpour, cardiologist with the Lima Memorial Heart and Vascular Institute, here to talk about cardiovascular disease and same-day cardiology appointments. So thank you so much for joining us, doctor.
Good morning, Chris. Thank you for having me.
You're welcome. Well, firstly, can you tell us more about cardiovascular disease and the most common conditions?
Cardiovascular disease relates to anything that has to do with the arteries of the heart, valvular structure, electrical function, as well as the pumping function of the heart. And depending on the problems that you could have with a specific structure, a specific part, symptoms of a patient would be different. And these are pretty much what we refer to when we talk about cardiovascular diseases.
Right. And then what would be some of the common symptoms of these heart conditions?
The typical symptoms are some type of angina, which is referring to chest pain, heaviness, discomfort. Sometimes pain and symptoms could be in the shoulder, in the neck, between the shoulder blade, and they sometimes radiate to a different part in the chest. And also it could be shortness of breath with activity beyond and above level of activity that they normally are able to tolerate. The onset of either one of those could be indicative of some type of a cardiovascular problem that requires further workup. Now, in case of electrical abnormalities, patients could simply experience palpitation, fluttering, lightheadedness, and symptoms of syncope, perhaps. And those are, again, variety of different symptoms that they can have, all of which could be directly related to the heart.
And I understand that Lima Memorial offers same-day cardiology appointments to address some of these concerns. So can you tell me a little bit more about the process, or maybe when someone should actually just call for an appointment or call 911?
We've had this program for almost 2 years. It's been a great success. Patients can just pick up the phone, call Lima Memorial Cardiovascular Office, and request a same-day consultation. We typically would do everything possible to bring them in within the same day. They would get to meet with the physician. Their symptoms, their previous testing that might have been done either at Lima Memorial or other facilities will be reviewed. And then further testing often needs to be done. And sometimes in the first step, additional medication can be given. But often the additional testing is required, which typically would get completed within 2 or 3 days, and then they get subsequent visits, and we review those with the patient and decide where we would go. The wonderful thing about it is waiting 1 month to see a cardiologist is no longer something that people have to experience. All they have to do is pick up the phone and they will get to see a cardiologist same day, which is almost unheard of.
Right. And then how do you know if someone should make an appointment or if they should just call 911?
If they're having symptoms at the moment when they are thinking about seeing a cardiologist, and those symptoms are abrupt, they are severe, really they don't want to come to the office. That would be best to go to the emergency room, call 911, and that would be a more proper way of addressing the problem. But if they have intermittent symptoms, they had symptoms last night, but right now they feel good, or they're concerned about it, or they even simply have risk factors, their close family member just recently suffered a heart attack, or they know that they have risk factors of smoking, perhaps their cholesterol is up, hasn't been addressed before. Those are the situations where they could easily pick up the phone and contact us, and we'd be happy to get them in as soon as possible and work on getting to the bottom of whatever problem they have.
All right, and then what if somebody might need further care for their heart condition after a same-day appointment?
Sure. It is not uncommon to require additional testing. Those tests could be stress tests, it could be an echocardiogram, or even in some instances, based on an initial review, we may determine this individual needs to have a cardiac catheterization. Very often, those additional testing can be scheduled within the 2 or 3 days after the initial visit, and they get back to the office, we review the results with them, and hopefully get to the bottom of what the problem might be.
Right. And on our screen, just to let you know that we do have the number for people to call in case they want to schedule a same-day cardiology appointment. So, Doctor, we do appreciate you coming in today. I thank you so much for that.
Thank you so much. Have a wonderful day.
You
Thank
too.
you.
Well, don't go away. We have more when we return.